Hello everyone, it's Dr. Teba and today we will study about the KUB ultrasound normal versus abnormal images. The chronic kidney disease also causes increased echogenicity of the kidney along with some poor visualization of structures such as medullary pyramids. We don't see them very clearly in this image. Now we study the creating of cortical echogenicity. Now the normal one will always be the renal echogenicity that will be less than the liver echogenicity. As we can see here, the cortex is hypoechoic as compared to the liver. Now on the right side, this is grade 1 echogenicity. We can see the liver parenchyma and the cortex of the kidney. They have similar echogenicity. They are matching. In grade 2 echogenicity, the renal echogenicity is more than the liver echogenicity. In renal failure, the kidney is very hyperechoic and it is also reduced in size. This one we can see is almost 6 centimeters only, whereas the normal size range is above the 9 centimeters. Angiomyolipoma is a benign renal tumor which consists of vascular smooth muscles and fat tissues. It is usually a round mass which is somewhat hyperechoic. Another longitudinal view of the kidney showing angiomyolipoma. Here we can see the rounded hyperechoic mass in the lower pole of the kidney. Willem tumors is a rare kidney disorder. Here we can see a large heterogeneous mass located in the upper pole of the kidney. Renal cell carcinoma is a malignant condition of the kidney. Here we can see a heterogeneous mass in the upper pole of the right kidney in the longitudinal view. Renal cell carcinoma in transverse view. The mass, nitrogenous mass, can be seen here occupying the cortical and medullary regions. Metastatic lesions usually appear as heterogeneous masses in the organs. Another heterogeneous masses we can see in the upper pole of the kidney. This is also a longitudinal view. Sickle cell anemia can also cause hyperechoic kidney or echogenic kidneys, usually the medullary regions, as we can see in this image. The medullary regions are echogenic. This can lead to kidney injury and chronic kidney disease. Cross-fuse ectopia is a condition in which both kidneys are found fused together. Here we can see the two separate renal sinuses and also this groove here that separates both the kidneys. And this is on the left side of the right side. In this case will be empty. It will not have any kidney. Cross-fuse ectopia in the longitudinal plane, we can see two separate sinuses again more clearly. In renal trauma, the hypoechoic and heterogeneous areas are due to hemorrhage and hematoma. In this image, we see the proximal ureter that is somewhat dilated because of the presence of a stone and it causing the dilation of the renal pelvis as well in grade 1 hydronephrosis. The renal pelvis is dilated but the renal calculus are not dilated. In grade 2 hydronephrosis, both the renal pelvis and the renal calluses are dilated. In hydronephrosis, grade 3, both the renal pelvis and catalysis are dilated due to a greater degree as compared to grade 2 hydronephrosis, and we can also see some cortical thinning. Grade 4 hydronephrosis shows a very large degree of dilation involving the entire kidney. and there is also a high degree of cortical thinning, and it is leading to renal atrophy. These are normal views of a dilated bladder. This is a longitudinal view, and here is the transverse view of the dilated bladder. Cystitis is the inflammation of the bladder. In this image, we can notice that the bladder wall is thickened. Now, if there is cystitis, the wall thickness of the bladder must be more than 5 millimeters. A stone in the bladder with posterior shadowing. The stone is appearing hyperechoic. Bladder debris appearing as hyperechoic area along with some heterogeneous areas in the bladder, which would normally appear anechoic if it is only fluid filled with urine. Usually it is due to the bladder injury, hematuria, or any injury to the urinary tract. Bladder cancer, usually called transitional cell carcinoma, appears as a rounded, heterogeneous or round hypoechoic mass originating from the walls of the bladder. Thanks for watching. Subscribe for more imaging videos.